Okay, so let's do another question. Where will you be in 5 years? And this is a very common question. What will you do after residency? Where will you be in 3 years from now? So that's sort of the same question. And most of the time, um, you will say, if you have in your mind that, okay, I will definitely be going for this fellowship, or I definitely know that I will be going through for a fellowship, then you can be positive about it. But of course, you need to know whether that program helps for that fellowship, or they already have fellowship programs, for that fellowship. And yeah, so two ways to answer. If you should say, yeah, I'm looking for this fellowship. You, of course, you have done the research that that program has those fellowships, or the residents have gone to those fellowships, even though they don't have that particular fellowship. Or the second approach is that, hey, I'm unsure, but I will be deciding possibly by the end of my first year what I want to do. Okay, so different approaches. If you're definitely not sure, then you can go with the second approach. I would, unless it is a brand new program, um, I would still say that you should suggest that it's still, I haven't put a finger on it. However, I do believe that I may be deciding for a fellowship at the end of the year, and um, and um, and I can see what specialties are being offered, or which specialties this program is looking to assist in, and what are the strengths with the teaching staff over here, with the teaching staff over here, and I'll gain feedback from them, and what is possible, what is not, I'll take calculated risk on what I want to pursue. I think it's my opinion that even if it's a 100% community program with nobody going to fellowship, which is rare, which is very, very rare, very rare. Um, if you have that program that has no fellowships, their graduates don't go anywhere, or it's a brand new program, you can still say, I will decide at the end of the first year what I want to do. And of course, I will seek mentorship and feedback from my worthy attendings. But on most occasions, you will be saying, yeah, I might be interested in these fellowships, or I will definitely be deciding by the end of the first year. So no,
Okay.
But it would still be fair game if the program is brand new. I think somebody had a program that they're interviewing at that is brand new, fresh. You can always say, um, I plan to practice as a family medicine physician, set up a clinic or join a group practice, or possibly connect with the hospital system, maybe possibly at this residency program down the line. Um, um, or for internal medicine, you can say that it's a brand new program for internal medicine. They have no fellowships, nothing. They haven't mentioned anything that they will help you towards fellowships. If they haven't mentioned anything, they have nothing on their website, then you can say, then you could say that, yeah, I don't feel that I may need to do fellowship. I feel that I need to make myself as the best internal medicine physician, and I have seen I have seen internal medicine clinicians practicing as internists as well as hospitalists, and I seem to like that as well, fairly strongly. So that is up to you if you want to say that. Only in the event that there is no one, they have not explained anything about whether they will help you towards fellowships or not. Most programs would say that, yes, we will help you. We will help you prepare your research papers, abstracts, and get you towards the goal. We'll try to make phone calls. If the program doesn't mention on their website where their residents might be going, or where they will help them secure spots, then possibly say, yes, okay, I think this gives you lots of flexibility when you are working as a hospital medicine physician. You're working 7 days and you're off 7 days in most situations. Many big cities in New York, perhaps they don't have this type of schedule. However, most places have a very friendly work-life balance with their schedule. But these situations will be very few, that they will not help you at all for any fellowship. So let's just talk about an answer on a possible fellowship route. Okay. So good question. And yes, of course, I can't really predict the future. But in 5 years down the line, I do see myself practicing as an internal medicine physician, possibly pursuing a fellowship. I have in mind cardiology and gastroenterology. And I do see that you have these fellowships being offered at this program as well. So that is great. And during my residency, I wanted to definitely strengthen my skills in managing all the different types of complex chronic diseases, not only just for my targeted fields of cardiology or gastroenterology. So I want to be a well-rounded physician. That's what I see myself in the next 3 to 5 years. So I'm definitely passionately interested in cardiology and gastroenterology, and I do believe that this aligns with my goals in providing long-term care for the patients as well, because I do believe that cardiology and gastroenterology are part and parcel of a person's life, as you would agree. And by the end of my residency and fellowship, I hope to have developed not only the clinical expertise, but also the leadership skills necessary to advocate for my patients. And I want to contribute to advancing patient care. Thanks for asking. I'm still not 100% sure, but I do believe that I will be going to one of these 2 residencies. So yeah, so this is a typical answer. And of course, you have researched the program. They have a cardiology fellowship. They have a gastroenterology fellowship. And yeah, you can mention it. If they don't have these fellowships, but you know that the residents matched into fellowships in cardiology and gastroenterology, that definitely means that they went through this program and they succeeded. So yeah. Any questions about this, Javeria? Javeria has a hand raised.
Dr. Umar, can I take over and ask a question?
Sure.
Dr. Umar, the questions, they seem very professional the way you approach them. And it feels like you really need to be prepared with the way you build up that answer. My question to you is, if you decide to take a lighthearted approach, and you decide, okay, if they ask you, where do you see yourself in 5 years? And you try to go off on why you think that in 5 years' time you would be interested in a specific field, and you take them along a ride, like a story that you might want to mention. Would that be all right?
Yeah, you want to give an example?
Yeah, okay. Like, for example, I've always been interested in cardiology because I learned more about it because one of my family members had a phobia for heart disease. So in order to convince him that he was okay, I would need to have all my research at hand. So that's how I got interested into cardiology. Would that be a funny story to tell?
Yeah, I think everything is okay. Yeah. But somebody can ask, okay, how does, okay, does somebody have a remark on this? Does it appear that it really connects him with cardiology?
Yeah, someone should tell me if I'm messing up.
Any thoughts?
Or forever hold your peace. Speak now or forever hold your peace. So, Dr. Umar, I don't think they care. They want me to fail.
No, you're not competing with
No,
them. They're all family medicine.
no.
They're all family
No,
medicine.
yeah, I think that was a strong connection, Dr. Mohammed. I feel that is an example you can present, and it makes your story more stronger than you could imagine.
Thank you so much, man.
Anybody else? Feedback?
Say anything, please. Help.
He's gonna use this.
Use this. This might be big, guys.
He's gonna use this.
Yeah, because one thing I realize is that people connect more with examples than just stories, So if you're able to present an example, it makes your story more stronger and more memorable than just telling a story, So for me, I feel that is something that we should go with.
Yeah, perfect.
Definitely great.
So, can you hear me?
Yes.
Yes.
So, Dr. Abdullah, I will say, rather than saying someone have the fear of having some cardiovascular disease, if you say that someone has the cardiovascular disease, but they were not clear about it and they have different questions and concerns about it, and that was your relative, and then you read about it and explained them, and it was during your internship, maybe that's how it sounds good and more effective.
I know that sounds so serious though. I'm trying to make it less serious. If I tell them that there's someone suffering from heart disease, they'd be like, oh, I wanted it to be different. I thought that everybody mentions someone they've treated.
Yeah, maybe, but it sounds vague. Like,
Okay.
what concerns they have, like which cardiovascular disease concerns they have.
Okay. Thank you.
Obviously, you can't read whole cardiovascular medicine to explain them.
Okay, I get your point. Thank
I
you
think
very much.
I think what she's saying is that maybe a bit more detail.
A bit more specific.
Yeah, you're right. Absolutely.
Like you can say they have concerns about, but say that they have symptoms of a that resembles to this disease, and then I read about it, or 2 to 3 diseases, then I read about these diseases. Maybe because if you say only concerns about a disease, that it will cover whole cardiovascular medicine.
Yeah, I was more thinking along the lines of people coming to, people with anxiety disorders. They usually have presentations in which they feel like they're having a heart attack because it mimics.
Yeah,
So
that sounds good.
One thing to always keep in mind with comedy, you're not 100% sure what is the mood of the person.
Yeah.
Yeah.
So yeah, that just a thought. Comedy is good. You just need to be sure that the person will be receptive.
Yeah.
Maybe when you are in the interview and you see the person to be a lively individual, then possibly yes. Yeah, I think just be cognizant of that fact.
Perfect.
Right, good.
Yeah. No, but for me, I feel even if the person is so comedy-like, it's still very important for you to maintain some level of professionalism, because that could be a trap and they want to know who you are. So you still want to maintain some level of, how do I put it? Say keep it professional, okay. Don't be overtly familiar with a person, not like you're gonna frown your face or make your face look like a rock, but just trying to maintain that this is someone you're seeing for the first time, and you just want to make it professional as much as you can, while keeping yourself friendly. Joking, I don't know if joking is allowed, but I would avoid that.
What you can do is practice with someone. You have good ideas. Practice with someone and get some feedback, as you're getting some feedback right now.
Yeah. Yes, of course.
Yeah.
Thank you everyone for the feedback. That really helped. That helps me to formulate a plan of action.
Great. Okay, good.
Okay.
Yes.
Dr. Khan, I have got a question. Can I ask?
Sure.
Yeah, so one of my interviews is from a program, like it's rather new program, only 2 classes, and they're no class haven't graduated yet. So I was thinking, how should I answer the question about like any plans for my future? They mentioned on their website that they want the residents who are interested in rural medicine. So how should I align my answer according to that?
Okay, so that would be then the first example, one of the examples that I was trying to give about that this program is mentioning that they're not probably helping you for fellowship.
Yeah.
Right. And you can say that, yeah, it seems as if that was the program that, would fit that criteria. Not many programs will fit that criteria. And that program will certainly fit that criteria, where they are not looking to help you towards fellowship. So you would say, Well, of course, I don't know what might happen in the future, but I have certain plans in my life, and I do believe in work-life balance as well. And I do feel down the line in 3 to 5 years, I will be a practicing physician. I'm not too inclined towards fellowship. However, I look to become the best clinician possible, and I do feel best clinician possible, possibly starting my own practice or a group practice, or possibly attaching to this particular hospital as well. Or the hospitalist route is also very enticing given the schedule 7 on, 7 off in certain areas of the US. So it is up in the air right now. However, I do feel that I would want to practice I do want to go into journal medicine. And I do believe that might give me a better work-life balance. Although fully dedicated to the care and well-being of my patients. That's what I hope to do in the future.
Yeah. So while mentioning the work-life balance, is it okay to say that being a woman, it will be great for me to have a work-life balance between my, in future, my house and my professional life? So is it okay to say that or not?
I wouldn't say that too much. I would just mention it that I believe that as a family physician or opening a clinic will give me my work-life balance, or
Okay.
working
Yeah.
as a hospital medicine physician will give me the work-life balance that I'm looking for.
Yeah. Okay. Okay. Got it. Thank you. Thank you so much.
Okay.